We have in studio Mr. Worldwide himself. This gentleman is no ordinary man. Now, in Grenada, everyone, wants a piece of this man. His name is Patrick Delves. And he's not only here in Grenada doing his work, he's everywhere talking about herbal medicine, alternative medicine, and so on. Folks, I am happy to really present to you tonight Mr. Worldwide Patrick, the man himself, Delves.
Wow. What, man? Greetings.
So, how are you, Patrick?
Well, blessed,
Yeah.
Fasting, but I'm okay.
You're fasting? Oh yeah, I think I saw you said you
7 days.
7 days.
It's my 5th day.
Okay. So
I ain't fallen on dead yet.
that's what I'm gonna ask you now. How do you feel?
Good, man.
Yeah.
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 I feel good. I feel strong. I don't want to eat no food. I want to go for 10 days now.
Yeah.
Yeah.
Clarify this for us, Patrick. They say that you are older than 60.
Yeah. Put that next one to it.
Whoa! Whoa!
Yeah.
And you're saying that the herbs and how you treat your body is totally responsible for how you look right now. Given that you're in your 60s.
Mm-hmm.
All right.
Yeah.
All right.
It's how you look, how you take care of yourself.
Mm-hmm.
I don't eat at night. I eat once per day, 3 days per week.
Yeah.
Yeah. So, I don't, a lot of people doesn't understand the basic principle about keeping the body healthy. And a lot of us eat 3 meals per day. We go to bed with food in our stomach. And then, when you're resting is when the body's supposed to be healing. Mm-hmm. And lots of the time, we practice that way of eating for years and years. And then after we reach 30 and 40, we start to have trouble with high blood pressure and diabetes and all these kind of different ailments and even cancers too. And that's because we were not taught properly of how to take care of the body, how to eat the foods. Because food is for medicine, food is for medicine, man. If you don't use food for medicine, food won't get you sick. You know what I mean? And that's the reason why a lot of people get sick, because they were not taught how to use the foods the right way. So, for instance, I'll give you an example. You don't eat fruits in the morning if you're living in a hot climate. Mm-hmm. You don't eat fruits at night if you're living in a hot climate. You don't do that. Because fruits are cooling food. You don't eat proteins in the night when proteins take 12 to 14 hours to digest alone in the stomach. Because you're going to be sleeping with food in your stomach, in the earth, I call it. And then all of a sudden, the body can't heal, because the body can never heal, but the body can never heal when it's sleeping if you have food sitting in the digestive system. It's just a common sense thing. Mm-hmm. So it doesn't have to be very educated to understand these basic principles about the food. So that's why we're going all over the world. We're going to Ethiopia in September. And we're going to teach our people over there, Ghana, Uganda, Botswana called me today. So it's I really want to go to Africa, because that's where it started, Mm-hmm. But if you look at the Caribbean, I want to start first in the Caribbean, because the Caribbean countries are full of cancers now, especially Grenada. And again, cancer is an immune disease. It's come from diet, 80% of it. Mm-hmm. So we have to look at how we eat the foods and how we teach our children, because as long as we eat the wrong way, and we have our children following the pattern that we have, and we eat, we're gonna have the same problem eventually. That's bottom line. So, and that's why the doctors don't come and say to us, you know what? Your mother had it, Mikey, your father had it. Your mother had it, your father had it, and you're going to get it too, because it's genetics, it's genes. It's in your genes. That's not true. You have what we call a genetic predisposition of getting these things. So if your mother taught you how to cook, or the daughter, and the daughter looked at how her mother cooked her foods, and the daughter started to practice that way of cooking for her husband, and her mother had hypertension, her mother had diabetes, it's a common sense thing, that the daughter, won't get diabetes too. You know what I mean? And then she feeding her husband the same way her mother been feeding her husband, her father. And the father have high blood pressure and he get prostate cancer, prostate troubles, and she feed her husband the same way, he won't get the same problem too. You see what I'm saying to you? Mm-hmm. So so these medical people make us feel it's genes. It's not genes at all. It's you have what we call a genetic predisposition. My mother was blind, right, before she died.
Right.
And her mother was blind too. See what I'm saying?
You're not blind.
Me, I would
You sure you're not blind? Can we check?
5 fingers I have a plan. No, but I'm saying, and that's a good example because my mother ate the same way her mother ate. And I look at my mother and my grandmother, and my mother died at 97, my grandmother died at 101. But they had problems though. You know what I'm saying? And she was blind and her daughter was blind because my mother ate the same way her mother ate. And I'm trained from that because I had a stroke at 32 years old. You follow what I'm saying to you?
Yeah.
And you usually, when you get a stroke, the first time you look, you will get another one eventually, and the second one is worse than the first one. So I learned how to use the foods, how to take care of myself. I fight epilepsy, I fix epilepsy, I fix migraine, I fix my stroke, and then I try to teach other people the same way. So that's the reason why I'm here teaching, man. Because I've been through it.
Well, we are happy to see the work that you're doing, not just in Grenada, but worldwide.
Worldwide. Yeah.
No, Patrick, there's something that we all do here in Grenada. We pay a lot of attention to the herbs. And we hear this herb is good for this herb is good for that. And sometimes we just drink herbs indiscriminately, and probably we may have results that we do not desire. You know, so tonight I want us to focus on some of these herbs and what they really do to and for the body.
Wonderful. Well, this is going to be a serious program because that's in my backyard.
All right.
Because herbs fall in different categories, right? You have food plants. So, for instance, cloves, garlic, ginger, they're all food plants. They're food herbs. That's and thyme, small thyme, because we put them in the foods that we cook. And there is a reason for putting the food herbs in your food. Some of them fight parasites. Some of them, keep the lungs healthy. Garlic does a lot of things, antiviral. So if there is any kind of troubles in the stomach and you have this garlic in your foods, it could kill any kind of virus in the stomach walls. So they're food plants. And then you have another set of herbs that fall under what we call medicinal plants. Medicinal plants meaning that these plants work in terms of a sickness. If you have a problem or you have a condition and the condition is grave or chronic or what we call acute, you use these plants to fix that acute or chronic problem, and that's what we call medicinal plants now. And once that problem is repaired, these herbs should be stopped. That's how it works. Basic principles in herbal medicine. You're not drinking herbs like just go and boil, they call it bush and go drop on it. It don't work like that, man. Then you have the poisons of the plant, because plants have chemicals like drugs do. See? So let me give you a few poisonous plants. Foxglove, bitter burr, comfrey, chaparral. They're poisons. And they have what we call pearlizidin alkaloids in these plants. So you have to know what plants have the alkaloids and how the alkaloids can harm your liver by giving you venoocclusive disease long term. So what we do in herbal medicine, we stay away from these plants, or if we're going to use them, we mix them with other plants to cut down on the side effect of the herb. So you have to know. You see what I'm saying to you? That's why going to school and learn about how the plants work is very significant.
All right.
So that's a good question that you ask.
All right.
You don't just go and boil herb and drink it.
Because it could create some. It could have some negative effect along the way.
Well, most of the plants don't. But as I said before, if you don't know the chemical makeup of the plant, you can have problems. So, for instance, Goulentia berberin. You know what I mean? And you have plants that have tannin, you have plants that have coumarin. And these chemicals, some plants have 400 chemicals. Some plants have 50 chemicals. Then you have one of the chemicals that is negative. You know what I mean? And then the other chemicals that cut on the side effects. So I've given an example, marijuana. Marijuana has a THC and it have CBD. There are two chemicals in that plant. But marijuana also have 400 chemicals. But these two main chemicals in the marijuana plants, we call it ganja in the Caribbean, the CBD is the one that has the medicinal properties. So now the scientists saying, okay, well, CBD is good for asthma, it's good for seizures. So what they're doing now, they're planting the plant and they're using the chemistry, what they call biochemistry, and they're raising the CBD of the herb, the marijuana plant that is, and then they're keeping the THC down. So they have so they use it now as a medicinal plant. But in the Caribbean, they plant, and when they plant it, they get you high. So it have more THC and less CBD. You see what I'm saying to you?
Right.
So the THC in the marijuana plant, marijuana smokers want to doubt that too. It kills your brain cells.
It does.
That's what it does. That's why a lot of people who smoke marijuana for a long period of time can't remember nothing. And my brother is one of them. You put on a piece out, you put on a pen here, you come back, you go in the kitchen, you come back in your head, put it down, you forget. And that's a fact.
Okay,
we have to understand these basic principles instead of defending certain things.
Right.
So what they do is they increase the CBD in the plant and they cut down on the THC. So it's the same principle that you have in other plants that have negative and positive. You know, you have to know what the negatives are and you have to know what the positive are. So give a good example of a herb called licorice. Licorice is a wonderful herb for the glands. Good for your lungs, good for your stomach. But it also have a chemical that can cause a person to retain sodium. So your pressure goes up. You see what I'm saying to you? So if a person who have high blood pressure come to me and they have troubles in the glands, we call it the endocrine system, and they have troubles in the adrenal glands. Now we know for a fact that licorice is a herb that's good for the gland, that particular gland. But we know we would not give that herb to a person who have high blood pressure. Why? Because it's going to make that person retain sodium and the pressure going to rise. So we're going to give them another plant that don't have that problem, that have the side effect. You see what I'm saying to you?
Right.
Yeah? Then we have another plant called Angelica. And Angelica is a herb that works on the stomach to help to normalize the acid function in the stomach walls. But if you have diabetes, you don't use it. Make your sugar go high. See what I'm saying? So we have to know all these principles. People have to learn about the basic principles of a plant. And you have to know if the plant is hot, if the plant is dry, if the plant is damp, if the plant is cool. You know, so you have to know the energy of the plant, because you must know the energy of the individual in order for you to prescribe the plants that's going to be good for that particular individual. Good example: orange peel, cool and bitter. Turmeric, warm and bitter. You see what I'm saying to you? Then you have sea moss, which is a damp plant. So if you have a damp condition of your lungs, meaning that you're coughing and you're bringing up mucus, we don't give you sea moss, because sea moss is a damp plant. But if you have a dry cough and you want to moisten your lung tissue, we give you sea moss. You see what I'm saying to you? So you have to know what the condition is of the person and what the herbs, what category the herb fall under. Because you have pectorals, you have hepatics, you have antibacterial plants, you have antiviral herbs. You know what I mean? You have herbs that deal with anti-tumor plants. You have lymphatics. You have different kind of plants. So you have to know how to use the plants, so we don't just go and boil and drink.
Okay. So how do you recommend someone gets a better understanding as to what plant they should use for whatever condition they have? Because, for example, somebody go say, boy, I feel like coming down with the cold, I will go get some sugar dish. I feel like coming down with the cold, I will go get some lemongrass. I feel like coming down with... So how do they know what's best for them?
That's I just answered a question in a technical way a while ago. No, we know lemongrass is good for colds. Sugar dish is good for colds. We know that for a fact, right? But do the person who's going to use the sugar dish or the lemongrass or even honeysuckle, do they know what condition of the lungs, or if the cold is cold and damp, cold and dry, hot and damp, or hot and dry? You follow what I'm saying to you? So you have to know what the condition of the cold, what the condition of the lungs is. So I'll give you an example. If Mike, you come to me, Mike, you say, Patrick, I have a cold. And I say, okay, Mikey, you feeling chills? Yes, Patrick, I'm feeling chilly. I say, right, okay, that's a cold condition. But I'm feeling chilly, but I have a cough, and the cough is damp. See? So I know you have a cold, damp condition of your lungs. So I have to give you the appropriate plants to dry up the dampness. You see what I'm saying to you?
Right.
So if you come and say, okay, Patrick, I have a cold, but it's dry, I'm not bringing up any mucus, but I have a chill. I know that you have a cold, dry condition. So I have to dampen the lungs. If you come again and you say, Patrick, I'm feeling hot, I have a fever, and I have a cold with mucus, and the sputum is yellow, and I'm seeing blood. I say you have a heart damp condition. If you come and say, Patrick, I have a condition of my lungs, oh man, I'm feeling hot, and I have a dry cough. You have a hot, dry condition. So you can't go and pick up lemon balm or sugar dish if you have a damp condition, and if sugar dish and lemon balm is damp. So, yeah. Because when you drink that damp herb and you have a damp cough, and the herb ain't working, you go say, no, herb don't work, man. Their name is crazy herbalists. They quacks. You see what I'm saying?
Right. So you don't recommend people just get up on one day and...
Nah, man. You don't do that. You have to go to a herbalist. Well trained.
Right, yeah.
They say go to a doctor. You think I might want to prescribe, let's go give yourself some Zestril and some Atenolol? No. And some Alphenapil? And some Lasix and some Bezide? He won't do that. He has to go to a doctor. The doctor prescribe for that for him.
So there's a perception that herbalists like yourself are just practicing some informal way of treating symptoms and so on.
Symptoms? I don't treat symptoms, bro. I don't treat symptoms. I find the cause of the problem. If you treat a symptom, you can never fix it.
Right.
So if you, Mikey, come to me and say, Patrick, I have high blood pressure, I say, Mikey, you're stressed? Yes. Your pressure comes from stress. I work on your glands. I work on your endocrine system, and the pressure disappears.
Alright.
If you come to me and say, Patrick, I have high blood pressure, but I find I have a lot of pain in my belly, I say, okay, go take an ultrasound. Okay, Mikey, you take an ultrasound, let me see the liver test, a hepatic profile test. Okay, Mikey, look at you have liver stagnation. Okay, Mikey, let's fix your liver gallbladder. Huh? And I fix your pressure. Yeah? If you come and say, Patrick, my heart is beating fast, I have angina. I'll say, okay, Mikey, look at you have a blockage in the arteries. Let's unblock the arteries. Because once you have angina, you have troubles in the arteries in the first place. So then you unblock the arteries and your angina disappears, your pressure goes down, in it.
There's somebody, Patrick, online who says, this man diagnosed me over the phone the first time I spoke to him last year before my consultation, before my consultants were able to do so after 3 years. The man is good.
Yeah. Yeah. I could tell you what I could just talk to you and tell you what your problem is.
All right.
If I ask you questions.
All right.
You know what I mean? You know, a lot of people call me on the phone and they say, and I say, okay, I have that. So what you know? I say, but that's what it is. I know. I'm in the business a long time. I'm 60-something years old, you know. For a long time, man. So you know, so you could diagnose by the tongue too. Yeah, you could diagnose by the tongue. If a person have a coating on the tongue, you know that they have a lot of mucus in the stomach. If they have a cut in the middle of the tongue, that's a liver. If they have a swelling on the side of the tongue, that's a spleen. You know that it's stagnated somewhere in that area. So that's how you just know. You know, but if a person come to me and they have troubles, I work with the medical system here. I work with Spice Imaging Center. So I will send them to get an ultrasound or a CBC, complete blood count, or an MRI if I feel it is necessary to get that. Because I don't really, people call me a commercial herbalist because I work with doctors. See, you are herbalist, you work with doctors, yes, you have to work with them. You know what I'm saying? Because we can't see in your brain, so you have to go and get the MRI. It's a reality. Right. You know what I mean? So, you know, we don't do ultrasound, we don't do blood work. So and the blood work is important. So that's the reason why the medical system is important.
Okay. Now, you brought some herbs?
Yeah, man, I bought some herbs. Yeah, man, I bought some serious herbs too.
Alright. So folks, the Mr. Worldwide has brought with him some herbs, and he's going to tell us about the uses.
Now, I deal with formulas. Because one herb don't really do the job fast. You see what I'm saying to you? So, if a woman come to me and she have fibroids, and the fibroids is causing her to bleed, yeah? And the fibroids is, say, 3.5 centimeters. We have to look at the pelvic, we have to look at the growth of the fibroid, we have to look at the woman's diet, and we have to look at moving the blood. You see? Because when you move the blood, you shrink things. That's just common sense, yeah? So what we do, we use plants like Danqui. This herb called Danqui right here. It's a herb that moves the blood, but it helps the liver to excrete excessive amount of estrogen via your liver. Am I putting it up right?
Yeah. We seen it.
You seen it right there?
Yeah, man, yeah,
Mikey, you're that genius, man.
I know, right?
That's what I'm saying.
Yeah.
Yeah. So this is the herb we use for women who have fibroids, ovarian cysts, and they want to shrink it.
Right.
It shrinks the fibroids, shrinks the cysts, but it moves the blood. But it's not only good for women, it's also good for congestive heart failure. You see what I'm saying to you? Because when you have congestive heart failure, because the heart is congested with a lot of things, so the heart can pump the blood to the vessel walls well. So your kidney suffers like a swelling of the feet. See? So this herb also moves the blood, but it helps the liver to remove excessive amount of estrogen, so the woman don't have growths in her uterus. But what I do, I mix it with about 5 or 6 different plants. So if a woman have fibroids, and I'm going to make a formula for the woman to shrink her fibroids, I also have to put a herb in there in the combination of the plants we're going to use to prevent the fibroids from becoming bigger. So we use palmetto. See? If the woman have bleeding, because the fibroids is kind of disintegrating, I say, okay, you're bleeding, you have menorrhagia, we're going to give you some shepherd's purse in the mixture. You see what I'm saying? So we put donkey, saw palmetto, we put shepherd's purse for the bleeding, and we put a saw palmetto in case the fibroids it stops from growing, but we also put the saw palmetto there to prevent pelvis stagnation. See what I'm saying to you? And then we use another herb called white peony. If there is blank or flank pain in the woman's ovaries, and she have what we call an ovary that's giving her pain, we inflame ovaries, we call it. We give her a plant called black haw. So we are attacking the fibroids, but we are also moving the blood. And we are also helping the liver to excrete an excessive amount of estrogen. So one plant alone don't really work. That's why I work with formulas. So if you have bad circulation, Mikey, I give you a formula called ginkgo horse chestnut. And in the ginkgo horse chestnut is ginkgo, horse chestnut, collinsonia, lycium fruit, cinnamon, and another herb called gota cola. Because they all deal with circulation, but they do different things to the veins. Instead of giving you ginkgo alone,
Well,
I give you a plants together. So that's what we see. There's a formula here. See, this is for high blood pressure. So we have about 7 different herbs in there for high blood pressure. So we're looking at the heart, and if there is water in the heart, we put herbs to move the water out. If there's water getting into the lungs, we put plants to move the water out from the lungs. If there is a heart is stagnated, we put herbs in here to tonify the heart muscle.
interesting.
Yeah, man. So you have to know how it works, man.
Yeah, you have to know how it works.
Yeah,
I
you have to know
took
how
a
it works.
herb in the form of a capsule, but I think it affected me in a manner that it was not supposed to. It was the same ginkgo biloba. And I know it is...
If it's standardized, you won't get a side effect.
Well, I had a terrible side effect.
Well, if it's standardized, you're going to get a side effect if it's standardized.
Okay, when you say if it's standardized...
Well, what they do with some of the herbs is the ginkgo have a lot of a chemical called tannins, but it also have a few other chemicals that help with brain function,
Right.
memory. So what some companies do, they remove all the other chemicals from the plants.
And they just leave one.
They got one chemical and they standardize it to like 85%, let's say berberine, or 85% tannins. But then to give you a side effect then. Because that particular chemical in the plant give you a side effect. But with the other chemicals that the plant have, it cuts down on the side effect of that particular chemical if the chemicals are there.
Okay, so it helps balance.
Yeah.
All right.
That's a beautiful thing about plants. So then the chemical that give you the side effect, now once they standardize it, you start to get nosebleeds. What's the side effect you had? What was the side effect?
Patrick is asking me what was my side effect.
I want to know what the side effect was, yeah?
It gave...
I want to know what the side effect was.
It seemed to cause overstimulation.
Oh, because you're talking about overstimulation. No, that's not side effect. That's a good side effect, bro. Your wife gonna be happy. Because ginkgo is good for that.
Yeah?
Yeah.
Okay.
Ginkgo is good for men who have impotence because of impaired circulation. That's what it's good for. It's not only good for the brain. You see, People classify herbs as good for the brain. Ginkgo is good for the brain. Saw palmetto is good for the prostate. St. John wood is good for depression. That's not true. They have other uses too, because I use St. John wood for AIDS and herpes, all the viral, because antiviral. See? And I use saw palmetto for women to make the breasts get big.
Oh.
If they have small titties.
Okay.
And I use it in women for pelvic stagnation too. So it's not only, and it's good for the lungs. So it's not only a man plant. And this the ginkgo is the brain hub, but I use ginkgo also for the eyes. When you have glaucoma and cataracts and stuff, eye circulation, I use ginkgo for the heart.
Okay.
But it also is a herb for men when they are stagnated in terms of impotence because of impaired circulation. But I use it with other plants, so you got a good side effect.
Nah.
Don't complain about the side effect.
No, that wasn't good at all. You
Don't complain about the side effect you got, but it's a good side effect. I wish I had your side effect. I tell you, man.
It could be embarrassing if you had to go out, you know.
You feel it? you gotta put a tape down and tape it down. Can't move, man.
So the side effect was so serious that I had to discontinue.
Oh yeah, I understand. Let me you don't need ginkgo, you're too young.
Yeah, because they say, it's good for the brain, and so I thought I was,
Not good for the brain, I'm good for that. It's good for you love. Can I say penis? It's good for your penis health too. And you see my when I get it now. So I guess when you bought it standardized. That's
okay,
why.
Okay, all right.
And that's the reason why you had that
side effect.
Yeah,
all
because
right.
it was standardized,
All right. Talk to us about some other herbs that you have that you know.
Well, this is one is Dunkpee. Then we have I have over 5,000 plants. This one is echinacea and golden seed. I like to use them together. These both plants here. They should have them mixed together, and I like to use them together because they do a lot of things for the respiratory system. So if somebody come and they have tonsillitis, laryngitis, they have any kind of inflammation of the throat or the lungs, then we give them these two herbs together, the echinacea and the golden seal mixed together. They work good together, and they're also good for sore throat and any kind of respiratory troubles, asthma. So I will use them together here too. Yeah, and then I have
Patrick came with a whole suitcase of
lots
herbs.
of them. Now, this is a herb that's very interesting. It's local. Yeah, this is a very interesting plant. So
That looks like that's from the corn.
Like the corn silk, or you call it corn beard in Grenada. I just use it. I don't throw it away.
Oh.
So lots of people who on the side of the street, you see they roasting the corn, you see they throw it in the garbage, but they ain't know. This is a plant that is an antiseptic to your bladder. It's good for kidney stones. It's good for prostatitis. It's good for edema. When you have a lot of water, retaining water, it's good for that. But again, we like to use it with other plants because they work better together. But don't throw it away, man. This is a wonderful plant, man.
How do you prepare it?
Well, what I do, I just dry it. I put it in the sun, and then it becomes dry. Once it's dry, then all the chemicals is manifesting. See? So I will dry it for about 2 or 3 days in the sun, and then I will chop it up, and then use a teaspoon to a cup of hot water. So that's what I don't throw the corn silk away. That's what I do. You know what I mean? So I come with all of them. This one is called sheep sorrel, and I give this plant to people who have cancer. Any kind of cancer treatment, I put in sheep sorrel there with another herb called periwinkle and podiaco and red clover, chop her up and mix them together. And that's what I use to treat my cancer patients, with lots of plants that have anti-tumor activity.
Any cancer, once it's a growth, actually.
Any kind of cancer, once it's a growth, because cancer there were non-forming tumor cancers, and there were cancers that have tumors. So for leukemia, I would use different kind of plants. But if the person have lymphoma, a cancer of the lymphatic system where they have lumps in the neck and in the groin, I will use these plants together, and then I will use plants for the lymphatic system at the same time to shrink the tumor. So that's how we work. We work again. You should look at this herb again. This one is called violet leaves. This one here. It's called violet leaves. Yeah. See violet leaves? See it here? This is good for the lymphatic system. When you have lymphatic stagnation, we use this particular plant with other plants again, about 7 of them, to help the fluid to come thin, so the fluid can flow better. You know what I mean? So it's a lot of plants, man. You see nothing yet, man. You see nothing? You see, man? You can see that? You see that? You see that? You see what? No.
Wow. I know you've been talking about Zooty.
Zooty, man. Look at Zooty right here, man.
Talk to us about the Zooty, what we can use the Zooty for.
Look, Zooty, we call it nettle leaf. This is Zooty, but we call it stinging nettle. And this is the interesting plant because when it's fresh, it stings you. So if you go and you touch it with your hands, it's going to sting you a lot. And that's why you got to pick up with your gloves. See? And you have the broadleaf one. So this is the broadleaf one. And this is the interesting plant because it is important for your kidney. If you have, it is a food for the kidney because it have lots of minerals. It have lots of boron, it have lots of calcium, it have magnesium, it have potassium. It is what we call a potassium sparing diuretic. So when you go to a doctor and you have high blood pressure and you retain in water, or they give you an ACE inhibitor like a Zestril, that we call them ACE inhibitors, the ACE inhibitors call the patient to retain potassium. So the doctor will give the patient a diuretic to remove the potassium out. But the diuretic he gives them moves too much potassium out, so you have to give them slow K. See what I'm saying to you? But with the Zooty, the stinging nettle, it has potassium. So although it makes you remove the excessive amount of potassium, it puts back enough whereby it don't affect your heart in a negative way. You see what I'm saying, Bridget? So it is a food for the kidney.
Right.
Then you have the root of the nettle seed, of the nettle plant, of the nettle root of the nettle plant. And the root shrinks the prostate gland if it's swollen. So when you reach my age and you start to have trouble in your prostate, use the nettle root. It shrinks it because it has volatile oils in that particular plant. The seed now, the seed of the Zooty plant regenerates your kidney. I'm going to use the word regenerate loosely because it's not me, it's them scientists in the UK, in the US, and in the Europe that is telling us that. They are doing research today as we speak on that particular plant. It regenerates the kidney. So when I have a patient who have kidney damage, not kidney failure now, kidney damage, we will give them the nettle seed, the nettle leaf, the cordyceps, the Romania, and then all of a sudden the GFR and the creatine and the BUN, blood, urea, nitrogen test, everything start to either the creatine, the GFR goes back up to 60, the creatine come back down. Just by using nettle seed. It is a regenerator of your kidney. Don't forget that now.
And you have the evidence to show that because you see.
Oh man, that's scientific evidence, brother.
Right.
It's not Patrick does, you know. It is scientifically researched. And if you want to bring it to science, I'll bring it to science tomorrow too. I'll bring it to tomorrow. We on the program tomorrow, right?
Yeah, we
I
also
will bring you the science tomorrow on not only nettle leaf but lots of other plants that have scientific evidence. Aniseed, cinnamon, ginger, turmeric, they all are scientifically researched.
Right. And I'm happy that you spoke of ginger, because ginger is very available in Grenada, and as I understand it, it is very, very, very useful for a lot of things.
Oh man, ginger, I call ginger my radiation.
I
give it to all my cancer patients, especially that and turmeric together. You see cancer cells? When they see ginger, they say, oh shoot, he's too hot, I can't handle him. Because that's what radiation is. So when they give you radiation, we know radiation causes cancer. So when you go and take radiation from the doctor, you have breast cancer, they give you radiation and chemotherapy. The radiation causes secondary cancers. And that's why the doctor will tell you, too much x-rays are not good for you, too much CT scan is not good for you, too much this is not good for you, standing in front of a microwave oven is not good for you, either for long term because they give you cancer. But they give you radiation for cancer treatment. And the same radiation that they tell you that is not good for you, they give it to you anyway, but they give you secondary cancers. So what we do with ginger is ginger have gingerol. Yeah? And you have to look for the hot one, because the big one is garbage. Don't buy that. That's garbage. Use that. That's garbage ginger. especially them from China.
Okay.
Anything you see made from China with garlic and ginger, don't buy it. Terrible. Garbage, don't work. But there are local people who make ginger here, who plant it. And it's the very small one. It's hot. Small, but it's hot. Fire. When you put it in your tongue, it burns. But when you get into the system, and them cancer cells see it, them cancer cells, oh, ginger, man, you was a crazy guy. I was scared of ginger. And they die. They kill cancer cells. With all the side effect.
Wow. Okay.
But they don't want us to know that. Because you could plant ginger, I could plant ginger. Your wife could plant it. Anybody could plant it. So there's no money in ginger as a cancer treatment plant. Because there's no money in there. See what I'm saying to you? But when they take the periwinkle plant, or they take the plant called UYEW, and they go into a lab, and they come back and give you a drug called Taxol from you, and they give you a drug called cisplatin from periwinkle, then they have 17 years where they could control that drug, and they make billions of dollars. But if you and I can plant ginger, they say, no, we can't make no money from that, so forget about that. Ginger no good for you. So they come and make you feel ginger no good, aloes are no good, this one is no good, because they have no control over it.
All right.
Once they could have control, then they say it's good for you.
Is there a recommended way to prepare the ginger for it to be effective, or?
And just juice it in a juicer.
What?
Yeah, man. You juice it.
Okay. Okay. So with sugar, honey, or raw?
Sugar. Now you're looking to suppress my immune system now. With sugar. Sugar suppresses your immune system by half an hour. Half an hour. Sugars suppresses your immune system by half an hour. At least for half an hour. At least. And it can't fight. So what I do, I juice the ginger. And I juice turmeric. I put them in the juice and I juice it. And I drink the juice.
Alright.
And if I want to put a little bit of sugar, I just say, I put an apple, green one.
As a sweetening base.
Yeah.
Okay.
But not them white sugar and them brown sugar people using all the time. And then I might use some beets, because beets have sugar too.
Okay. Okay.
And then I drink that.
Alright.
And I hot, and I'm going to say I feel it inside it. But this
Feel the heat.
burn, yeah.
Yeah.
And I say yes. I say them cancer cells gone. I put a piece of garlic in it too. And then the virus say, oh, shh. He's putting garlic in there, man. Oh, we should have can't survive. Because garlic is antiviral. That's how this fix AIDS.
With garlic.
I'm an ex-AIDS patient coming to your program. You're coming in soon, you know. I'll bring him.
Yeah,
You will meet
because
him, man.
I want to hear that story.
Yeah, man. It was full blown too. So when you have HIV, you must use garlic half a cup every day for 1 week, and then you increase it to a half a cup. Quarter cup for the first week, half a cup second week, 1 cup for the next week, and you drink up the whole immune.
And you're getting good.
You build back up your CD. They say the key is to build back up your CD4. You see, doctors and this medical system, they don't tell us these things because they're keeping all the cures from the layman. Sorry to say, Mikey, but you know what I mean. That's how it is, man. They are keeping the cures from you and I. They know their cures are there because there's only incurable people. There's no incurable disease. You see what I'm saying? So if you have, when a virus comes into your system, what happens, Mikey? The first thing you meet up is who? IgA. So AIDS come in, and let me tell you something. 97% of AIDS didn't come from sex. No, say it again. 97% of the AIDS, HIV, did not come from sexual intercourse. Check your vaccines. Check your hepatitis B vaccines and check your polio vaccines. I'm going to say it loosely. No. So when a virus comes into your system, your body have a mechanism called IgA. It means IgA. It's an antibody.
Right.
And IgA start to do what? Neutralize. And then it increases your interleukin 1, interleukin 2. Interleukin 2 and interleukin 4 comes in after. After the interleukin 2 and 4 comes in, then you start to produce your IgG and your IgM. These are antibodies that do what, Mikey? They neutralize the virus. They don't kill it, but they neutralize it.
Right.
And they keep it at bay because they don't want the virus to get into your cells. They don't tell you that though. See? Once the IgA and IgM neutralize any virus, AIDS, herpes, megalo, cytomegalovirus, hepatitis B virus. They neutralize it. They don't kill it. And then your cytotoxic cell comes in. And your chemotoxin cells. And your phagocytosis. They are what we call the bad guys. They will destroy anything. They will destroy you too. They will kill you if you give them a chance. So they come in, and then you have the interleukin 4, interleukin 6, then you have the T lymphocytes come in, the B cells, all the cells come in, and they have to fight the battle. Now you will get sick when a virus comes in, because remember that you're fighting a battle against a virus. So you will get a fever because what your mast cells have to raise your temperature now for the hypothalamus gland. So you get a fever. But a fever is good because the body raises the temperature because you do not want the virus to survive. While your cells killing the virus.
So that's what happens when you get a fever.
Yes, my brother.
So fever is not necessarily a bad thing.
That's what it make you feel it's a bad thing. It's not a bad thing unless it go high than 102 degrees Fahrenheit. You still get convulsions. But you must get it once you fight in a virus. That's when you get a cold, you get a fever too. Because each cold that you get is a different virus. Not the same one. See what I'm saying? So then all of a sudden, the cytotoxic cell come in, chemotoxins come, and they start to create toxins. Here they call them cytotoxic cells and chemotoxin cells, and start to do what? And they fight in the battle. But you're sick, and then all of a sudden, in a day or two, you get better. Why you get better? Because you kill the virus. Whereby another person who don't have good immunity stay a whole week or two and is still sick until the virus invade the cells. You follow me, man? Now, once the chemotoxins and the cytotoxic cells and the phagocytosis cells destroy the virus, here what happened to you now? Your body have wisdom, you know. Your B suppressor cells come in and says, he said, listen, man, you better stop fight because you killed the virus already. Because if you don't stop, you're going to kill the individual. Because you keep on fighting. That's why people who have lupus have that problem. People who have multiple sclerosis have that problem. People who have scleroderma have that problem. Because they have an overzealous immune system that is attacking their organs and kill them long term. You see what I'm saying? You see what I'm saying here? So all of a sudden the B cell come and say, listen, man, the B suppressor cell say, come on, you kill the AIDS virus, you kill the hepatitis B virus, you kill the herpes virus, now it's time for you to stop. So he stops him. They call it the B suppressor cells. And he stops him from killing you now. And he said, okay, you're a good guy, you kill the guys now. And then he has the B memory cells memorize the virus. He can't come back. He come back, he dead. Because his memory he's in the memory. That's why God is great, because God has created this machine. So all of a sudden he come back. Shh, he say you come back. You come back. Boom, you kill him off. And that's what they tell you when you get chicken pox the first time, you can't get it the second time.
Right. The body memorizes it.
There you go, brother. Your body's smart. But the way people eat today, they don't use no herbs to clean the system out. They have weak immunity. And that's why they're getting cancer fast. Because this gland right under here, your thymus gland, is the master gland of the immune system. And when you burn it big, and the older we get, it shrinks. But if you let it shrink prematurely, because of the way you eat and you're not feeding the thymus gland certain things, zinc, B6 and vitamin C, it can never make thymosin. And if you can't make thymosin from your thymus gland, you can never ever produce T lymphocytes that kills what? Viruses, cancer cells. Viruses, cancer cells. Viruses, cancer cells. Yeast, parasite, fungi. You can't kill them.
So how do you feed it?
With food that have zinc.
Okay.
You must feed it zinc. That's what it needs. If it don't get zinc, it shrinks prematurely. So you have to eat seeds, like sunflower seeds, pumpkin seeds, safflower seeds, almonds, you know what I mean? Walnuts. They have lots of zinc. So they feed the thymus gland. Pork don't feed it. Fried food don't feed it. Barbecue chicken don't feed it. KFC don't feed it. They don't feed it. You have to eat the food that feed them. Because they need nutrients to survive, to protect you. So if you don't feed them nutrients, how are they going to protect you, Mikey? So that's why I said that cancer is an immune disease. From the immune system is lacking.
You spoke about the turmeric.
Yeah, call it saffron in Grenada.
We call it saffron in Grenada, right?
Turmeric right there.
Talk to us about some of the uses of the turmeric. What can it be used for? I know people talk about turmeric when you have clot blood, internal bleeding, and so on.
Well, turmeric have a chemical called curcumin, and it is an anti-inflammatory plant. It's come from the curry family. You know, saffron is a family to it too. But I use it for when people have trouble in the liver. When they have trouble in the gallbladder, they have gallstones. I use it there. And I also use it for high blood pressure. I also use turmeric for people who have arthritis. Don't forget I told you that, huh? With ginger.
Right.
Right? And especially when they have swelling, if they have osteoarthritis or they have rheumatoid. And then I use it again for high blood pressure. If the person have a enlarged heart, it makes the heart go back to normal size. Not playing with that, man.
Turmeric.
Turmeric does that, man.
Saffron.
Not saffron is a different plant.
Okay.
Saffron is different than turmeric. It's like aniseed and fennel-seed. If you look at aniseed, you will say that's fennel-seed, but it's not fennel-seed.
So you're saying it's similar, but it's a slight difference.
Yeah, a slight difference. One is more cool than the other one. One is more common than the other one. But
what about the chemical properties? Would you say they are the same?
All right, let me give you an example. Barberry, Oregon grapefruit, and golden seed are the same chemicals. Berberine. But golden seed is more, I don't use it that regular because it could cause you to lose good bacteria in your bowels. Because the berberine content in there is more. So I will more use Oregon grapefruit or barberry because the berberine content is smaller. A small amount of it. Not as much as the golden seed. So the same thing with these plants that have similar effects or similar properties. We look at the one that have the least effective chemical that won't really drive and just jam you up, and then we use that particular one. So turmeric saffron is much more cooling than turmeric is. You know what I mean?
Okay. Somebody was asking here online, what is the correct dose that you use when it comes to using turmeric for the different reasons?
Once you're over 50 pounds, 1 teaspoon to 1 cup of hot water. Once you're over 50 pounds, 1 teaspoon to a cup, 1 teaspoon of the herb into a cup of hot water. You're going to cover it for 5 minutes and you're going to strain it and drink 3 cups per day. If you're under 50 pounds and the child is half a teaspoon to a cup.
Okay.
And then again, you have to know the herbs. You cannot mix the roots with the leaves and the flowers. Roots have to be separate than the leaves and the flowers, because the leaves and the flowers float and the roots and the bark sink in the bottom of the cup.
Right.
So you have to know where they work. See, it's a technical thing. That's I say, herbal medicine is not just.
Let's pick up on it.
Nah, it don't work so, man. That is bush medicine, man. What them talking about is going and boil up with bush medicine. I did herbal medicine. I did it fixing a person's problem and then taking them off the plants.
Mm-hmm.
You know what I mean? You're removing the plant because you don't want to take things forever. That is a death sentence to me. I don't believe in taking things forever,
Okay.
You know what I mean?
All right. And that's one of the questions that someone was asking. How often must one take herbs before they can actually work, or when they should stop?
That's a good question. I don't use herbs, I don't use them.
No?
No, I don't. He's a herbalist, he uses herbs. That's not true. I use them when I'm fasting. I use them because I'm fasting, and I'm on a fasting program for 7 days. So I'm not eating any food. I'm just drinking liquids. I'm just drinking water, coconut water, and herb teas. So I use them there because now I'm cleaning and I'm detoxifying my organs. So I use them for that purpose. And then after I come up my fast, I stop using the herbs until another 2 months again. I take another fast and start again. Unless I have a condition and I want to fix it, I will use the plants that is appropriate for that particular condition. You know what I mean? But when a person comes to me and they have a condition, herbs take a longer time to work than drugs. Drugs goes in and drugs have a big stick, like a dictator. Herbs go in and balance back the body, help the body to balance. That's the difference in herbs and drugs.
Right.
A drug company just say, oh, you have a symptom, boom, and you cover the symptom. See? and you feel good because you curb your symptom. But after the herbs done, after the drug's done, your symptom come back.
Come back again. The herbs may have a longer lasting effect.
Well, when I say longer lasting effect, it fixes your trouble so you don't get the troubles again.
Oh, okay, okay.
If you know to fix it. But because you see, a doctor was never taught in medical school how to repair disease. He was taught how to cover symptom.
Right.
So when you go to school, you say, the professor say, listen to me, you come here to curb to fix no disease, you come here to curb some symptoms so you could work for the pharmaceutical companies and get rich. That's what it's all about. So you ain't curbing nothing. So a person have a headache, give them an aspirin. You know what I'm saying? But you have to find out what's causing you to have the headache. See, so that's how I work. So a person might come and I say, okay, you want to fix IBS? IBS is going to take 2 months to fix. So you have to use these herbs for 2 months, but you have to change your diet. Because it's because of the bad diet that you had caused you to have IBS, Crohn's disease, mucus colitis, ulcerative colitis, and all these other ileitis that you have in your system, inflammation. Because they're all inflammation. And inflammation comes from what, Mikey? Irritation. Anything that irritates you will cause you to have inflammation. You see what I'm saying to you?
Right, right.
So you have to go to the cause of the irritation, and once you find the cause of the irritation, you fix the inflammation. And that's where turmeric comes in.
Okay.
So if you have the heart, and the heart is swollen, and the heart is swollen because everything needs space to work. So the heart has to pump the blood to the vessel walls. So the heart needs space. He's pumping, right? And he's doing that. He say, oh shoot, man, you have me all messed up because I'm enlarged. I can't pump the blood to. So the turmeric say, okay, I'll bring you back down. So turmeric comes in, he brings back down the heart muscle, and the heart muscle say, okay, he started to pump a little better. Ain't no drug could do that. Ain't no drug could repair your liver. No drug in the drug kingdom can repair your liver except one herb called milk thistle that does it.
All right.
So you got to go to that. That way you got to stay. I mean, you know we're going to Trinidad now, right?
You are?
Yeah, man, we having a trail in Trinidad, man. We having a trail in Trinidad, man. You know, we launching a herb shop in Trinidad.
Yeah?
Yeah, it's called Nature's Gourmet Garden. Yeah.
Oh, wow, big things happening, Patrick.
Yeah, man. Ashat and Asa, the husband and wife, and we doing that with them. You know, it's I think it's in the Ramsing Plaza. It's in Chaguanas. That's where we're going.
Okay.
By May or June. We've been going there for a long time in Trinidad.
That's what I'm saying. This man is Mr. Worldwide.
So Trini people have to come out because we have the grand opening. We're gonna have a big seminar there. Ashat and his wife Asha is gonna be there. The number is 868 235 8585. 868 235 8585.
868
235 8585.
8585.
Yeah, man, and we're doing a whole set. I'm gonna be guiding. I'm gonna be counseling there. We're gonna have some seminars there, and we're taking everything to Trinidad and Tobago now. And the next stop, is St. Vincent.
Okay, and when is you don't know yet when you're all gonna be going to St. Vincent?
St. Vincent when I come back from Miami, no, from Pennsylvania, because I'm leaving on the 21st of May, and I'm in New York on the 21st of May till the 3rd of May, and I'm going to Canada, Finch, Toronto from the 4th to the 8th, and then I fly from Finch to Orlando for a seminar on the 10th. Then I fly from Orlando to Philadelphia for the 12th, and then from Philly I go to Texas for the 15th, and from Texas I go straight back to Boston. Oh. And then from Boston I go to Jersey.
All right. Somebody was asking when it is that you're going to be coming to Canada.
The 4th of June in Finch, Toronto. I'm going to put it up on my site, on my page. Okay. So they'll know where. We're doing a book signing. We're doing a book, you know.
Okay.
Yeah. We're doing a recipe book on how to use the foods. You know what I mean? So we're going to do a book signing up there, and we're doing a seminar at the same time. You know. Then I might go to Montreal when I come back again. You know. But that's what it is, because we spreading the word, man. People have to get better. People are ignorant of the fact of their bodies. They don't know how to take care of their body. Right. You ask a person when they live at, where you live at? My liver? What's that? What are you taking care of your prostate? Prostate, what's that? Do women have prostate there? A man like me the other day. Do women have prostate? I said, women? You say women don't have prostate, bro? So we have to learn where they at. Liver, under here. Gallbladder and pancreas is tucked under your right and your left lobe of your liver. And the spleen is right around the corner. and then you have your intestinal tract around here. The large intestines around your navel, and in your navel is what we call the small intestines. You have to know where they are. Thymus gland is right over here. Thyroid gland is right over here. Parathyroid is over here. Parathyroid, pituitary gland is in your brain, right over there. Adrenal gland is on top of your kidney. You have to know these things. The ovaries and the hypothalamus gland is right over the pituitary gland. And the pituitary gland feeds off the hypothalamus gland. They feed off each other. Because all the endocrine glands work together. So they send, because they produce hormones that send messages to receptors to receive the messages. So they have to be in balance in order for the messages to be received by the receptors. Have to have good messages. They can't send wrong messages. And that's the reason why women get breast cancer. Because the messages that are sent to the receptors is the wrong messages. Because estrogen is not the real thing, is the man-made estrogen that is stealing the combination up to the woman's receptors and causing her to get breast cancer. So all these things women have to learn. We have to learn about the body. If you don't learn about your body,
problems.
It depends on the man. Because let me tell you something. Tell your audience something tonight. The doctor, the herbalist, the nurse, the scientist, he can never tell you how you feel. Never. He don't know. You can go and tell him how you feel because you have a symptom, but he don't know. He don't understand. See? So you are the best person to determine how you feel and how you should get better. See? We are only here to guide you, but we cannot tell you how you feel.
Right.
You see what I'm saying to you, Mikey? That's the key, man. So people have to learn how to take care of the body.
One more question, Patrick, before we go. A topic of discussion these days is the legalization of marijuana. What are your views on that?
Well, you know, it is. I always say, there are chemicals. We talked about that earlier on your program. Marijuana have CBD and it have THC. Now, if there is a way where the governments of the Caribbean countries, because America is doing it, the Netherlands is doing it, you see what I'm saying? But they're doing it, but they're burning the ganja feed in the Caribbean. How come? Why so? Why they could legalize the marijuana in Colorado, California, all these places, and have it as a medicinal plant for glaucoma and epilepsy and cancer, pain, and all these different ailments that you get. But when you plant it in the Caribbean, they send in the DEA behind you. How come? Something is wrong, man. So why you planting it, and then when somebody else planting it, you tell them it's bad for them? Right. So I'm saying to you, I believe in medicinal marijuana. I don't believe in the marijuana that have the high THC count. I believe in the marijuana that have the high CBD count, because the CBD don't get you high. See? And then when the CBD is there, then we know for a fact that if your child is suffering from epilepsy, you can fix that. If your child have asthma, you can fix that. If your child have any kind of troubles that the CBD fix, you can fix that. But the reason why they won't legalize it in the Caribbean, because they know they want us to keep on buying them drugs and them puffs, and them Tegretol, and them Dilantin, and them Phenobarbs. You understand? But they up there could make it legal, could legalize it for medicinal purposes, but they don't give it to you and I for our medicinal purposes also. That is my problem. So I'm saying I'm not in favor of marijuana that gets you high because it mashes up your brain cells. I'm not in favor for that. I don't smoke marijuana. But at the end of the day, I will be in favor of anything that is going to help your child, that's going to help my child, going to help somebody else's child to get better, not to take a drug forever and ever. Amen. See what I'm saying? So once it is beneficial to the public, then I am there for that. If it's to get high, don't conk me out. I don't believe in getting high.
All right.
Bottom line. Oh, well, let me show you some products we're going to have in the store in Trinidad. See them here? Oh, your man, see them? See that, Mikey? You're overstimulating everything on that. See them thing here? That's going to be in Trinidad. In the store we're going to have in Trinidad, you're having the Holy Immune. You got everything from food based. We're going to have some Rainbow Light Calcium. You know what I mean? We're having Kyolic Garlic. She's going to have all that down there. She's going to have Holy Immune. made by oncologist Dr. Jeffrey Downs. And this is very significant. We're going to make them carry this in Trinidad and Tobago. When they open the store, we open that store along there. It's angioblock. It prevents your cancer cells from creating blood vessels so they don't feed and they shrink. But they don't want you to know that though. And that's all we coming to Trinidad and Tobago, man. We coming to Trinidad and Tobago. If you're Trini, put yes. You're coming to be coming on it to you in Chaguanas. All right, don't forget the number. If you have the number, Mikey, 868-235-8585, and it's going to be launching sometime in June, May or June. And it's Nature's Gourmet Garden, and it's in Ramsing Plaza, Chaguanas. And we're coming to Trinidad.
All right. Earlier on, we had it up on the screen. Patrick,
Wonderful.
I don't know. It's your choice. Some people are asking how they can contact you. I don't know. It could be on Facebook, probably.
Mikey, I have over 1,000 messages in WhatsApp alone.
Right. So it's kind of like difficult.
Tough. Wow, man. And people getting mad because they say, man, I sent you a message since last month and you answer me yet. Man,
Right.
but people, then I have a Facebook page, then I have Messenger, then I have a fan base page, and then I have emails. So what I'm doing is now we getting some people together to help us to get a lot of the logging out, the backlog. We have a lot of backlog. And I'm hoping that our brothers from New York, the herbalists, will help us to do that, because no one man is an island. I don't forget that. We have to work together, the people. I always believe in that, and especially our people. You know what I mean? We seem to be strained in terms of that. I have a number you could get me at though. It's I just got a new number. It's 473-536-4046. Yeah, that's one number you could get me at, because that one ain't full up yet. I just got that one.
So just for advice again?
473-536-4046. The other one is because the other one is a killer. There are too much people in that particular number. So I'm just gonna give them the one that is not really full, so we could take the calls, and you know what I'm saying. And if you wanna email me, it's natural healing of the body 75@gmail.com, or the website is www.patrickdelves.com. www.patrickdelves.com. And I'm a Facebook page is Patrick Delves, so you can always message me there. So what we're trying to do, we're trying to link the Facebook page with the business page, so we don't have a lot of backlog, because we have 77,000 followers, and a lot of people just don't want to follow. So we're trying to get everybody to link together,
Right. That makes sense.
Yeah. We're trying to do that. We're trying to do things to help our people, because people need to be educated, man. We need to educate ourselves about how to take care of the body. I look at them on a fast. People say, if I fast, I go dead. It's my 5th day. I eat no food. I eat nothing, no food at all. And I have tons of people doing this program with me. And I have tons of people come and say, man, I never knew I was going to feel so good. The first 2 days are the worst days. But it's after the 3rd day, you ain't want no food. You're going to feel good.
Really?
I'm telling you, Mikey.
Okay.
One day we're going to do it together, man. I'm telling you. We're going to do it together.
Okay.
And the beautiful thing about fasting is, my daughter came tonight and said, Daddy, here's some ice cream. I said, no, I'm fasting. Daddy, please, take a little bit. I say, I'm fasting. Daddy, please, could you take a little bit? I said, no, I'm fasting. Because it make your mind strong. You have endurance, so that when you fast, your mind becomes so strong, man, that you could stop doing anything you want to stop do, and that is the purpose of it. For spiritual, mental, and physical rejuvenation, man. You'll be amazed.
Sweet, lovely, man.
Oh, man.
All right. Well, Patrick, I think... Yes, man. Jano. We gotta add that end to it, I just said Jano, and Patrick was like, woo!
Woo! Yeah. Say it again.
Jano!
Woo! Wonderful.
Oh,
man.
Lord. Well, Patrick, I think a lot have been said. This program has really served us well.
Yeah, man.
And I just want, on behalf of the viewers of the Mikey Live program, really thank you for coming by, at this odd hour of the night, to really share with us the information about the herbs, how we should treat our body, the uses of the herbs, and more. I know that this information will go a long way for a lot of us, and we really appreciate your selflessness in helping in that regard.
Mikey, you know I will do anything for you, brother. When you call me, I'm running. Even though I'm on a plane, I'm coming on the plane and I'm coming.
Hey, drop in. Drop me.
Yeah. The only thing is now, that 5-day, 7-day program, I can be like you. I can be overstimulated because I can't do nothing.
No, well, overstimulation is not the best feeling at all.
Right now, when I'm fasting, I can't even do that. I'm afraid to do that.
Yeah, can you might pass out?
Yeah, I gotta stay from that for the time being, man. You know, so that's an endurance, you know, that because you get strong mentally, so you could stop do what you want to stop do, you know, and that is part of it. So when I'm fasting, I don't indulge in certain things, you know. I just stay away from it. I just clean my system up, and I drink a lot of water, and I just go and pray, and I read my Bible, and I'm sitting in the sun, and I get all the vitamin D, you know, and I feel good. And when I finish,
right,
thank the Most High, and the next month again I start again. So I don't let nothing pile up in my system to harm me. By the time they pile up, I get rid of them. And that is what I want your audience to learn to do, to get rid of them before they pile up and harm you, to give you cancer, lupus, asthma, and any kind of condition that would hamper your quality of life.
Yeah.
Blessed Lord. Mikey, thanks for having me, man.
And we are happy to have you, folks.
I love you all too.
Yeah, man, that's good. The man.
Give me some love now, man. Oh gosh, man.
Alright, okay.
We love you, man.
Like,
oh
love,
Lord,
share. Oh gosh, I'll give Patrick some love. Let's do it now. Let's do it now, man.
Come on. Come on, give me some love, man.
Give Patrick some love, some love, and some shares right now, folks. Let the man feel appreciated. You know what I mean?
Man.
Yeah, no. Oh, Mikey, you should have him on your show more often. Listen, the guy is hardy even in Grenada. Yeah, no. So when we get him, we get him. You know. So tonight is what you love now. That's what we're talking about.
The love coming.
Yeah, man. The love. Yes.
I love you all too.
Right. That's it.
A lot of love. Love conquer all things, man. Don't forget that.
Yeah. Love.
Don't forget. Before you go to the altar to give your alms to the Most High for forgiveness, you better go back and forgive your brother. And then when you go back to the altar with your arms, your Father will forgive you. Don't forget that, because once you want to get better and you're sick, you have a disease. If you don't forgive, you don't have forgiveness, and you have hate, and you don't forgive, and you have animosity, you can never repair sickness. Or you could take all the herbs you want in the world. It will never happen. But you will have to forgive. And once you forgive, the healing process starts. I'm going to leave you with that tonight. Blessed love. Give Jah the glory.
Give Jah the glory,
all
folks.
The time.
Let's say thank you again to Patrick Delves, and folks, that's as far as we can take it for tonight. We have exhausted our time by half hour, so we got to cut it now and say thank you for viewing, and please don't forget to like, love, and share the program. All right, folks, and we do it right now in 5, 4, 3, 2, 1, and you know what we all say? Jah.
Woo!
I like that. Have a good night, folks, and God bless you as usual. We come back to have another program for you tomorrow, God's willing. Take care.
Breaking news. The government of Grenada has issued a public warning just this morning.
The escape of Project X is by far the worst thing to ever happen to our country.
What they are calling Project X is said to be a scientific assignment to try and end madness, but it now seems that they have taken it to a totally different and uncontrollable level.
The level of madness he possesses has never been seen before and is highly infectious to everyone.
Project X, better known as Muddy, is now a severe threat to society. When hitting to the streets, this is what they had to say.
Muddy is a real madman. Mad. Sick in the brain.
Bondsman.
Mad.
So today we pray for God. We sticking with cranium. And we know we share it out. And if you say you're mad, we mad. We sicker, you're high. We hyper than everything. I say you're mad. You're sick, you're high. Everybody know we want to match it up. Ransack the place, we love the party much. I pump the place, feel the party done. Head down, now we have all you what? A master go play one with. The place I go flat like this. People are go dash like you said, but because we head down, and we sticking with early up. So today we break on that. Yeah, me we sticking with early up. I mean up it, solid, yeah. And if you say you're mad, we mad, sick, you're high, we hyper than every. I say you're mad, you're sick, you're high, shaking up everything. Them got to win like a lion, we are the king. Ready to blow, cause we charge right up to the brim. So best you stay on the way. Stadium, a master go. The place I go flat like this. People I go dance like you said, go. Because we ain't, we taking with radio. So today we break for us. We sticking with radio. And we not be solid, yeah. And if you say you're high, I say you're mad. Look, represent with your rock right now. Represent with your flag right now. You know what I want? Let me see all mad people. What? Hey, turn up the madness. Turn up the madness. Turn up the madness. Turn up the madness. 1, 2, 1. Right now we singing with radio. So today we break for them. We singing with radio. And we not feel shelly. And if you say love, love. Well, I ready to kill people now. One job. Cause that's how I just did. Get mad. Somebody say kill them. Somebody say kill them. Somebody say kill them. One job. Listen me now. When it comes to wrecking first, I never mix. Why is he still saying he's a fish? Well, when this fuck electrify, gonna feel it. Shut the gun and they forget to pull the pin. Terror, you me, boy, got no mess. What's where, stop it up. This is my turn. And Mr. Squeezer, when I touch down, all you go have to run. So it's sticking it. And today we break for them. Yeah, me we sticking the radio. And we not feel solid. And if you say you're mad, you're sick, you're high. Look, we turn it up again. Hey, turn up the madness. Turn up the madness. Turn up the madness. Turn up the madness. Represent with your rag and your flag, everything. One. We sticking with radio. So today we pray. Today we pray for them. Sticking with radio. Sticking with radio. And we got to share it up. Somebody said kill them. Kill them. Somebody said kill them. Kill them. Somebody said kill them. Kill them. One job. Right? Hey. Time for me mash up the bloody stadium. The veteran he had to work for what he want. One way with your 30 years around. Plan to be specky and the bus we come. Them man, they are being you me boy but no. What's west don't be tough, listen. And when I touch down, all of all you go to. Now we sitting with radio. So today we break on them. We sitting with radio. Hold on. Look, all mad people, gather over here. Mad people, gather over here. All mad people, gather over here. Gather now. Oh, we going up, so. We going up, so. We going up, so. I think I'm down for. So are you wanna go? Why don't we sing in the cranium? So today we pray for them. We sing in the cranium. And we know be shining. Get mad. Stop. Steady. We going back down, right? And I want to see more speed than that when we going back down. Alright? So are you one? Get ready. Two. Get ready. One to bring us up. One. Two. Tell them we sit in the cranium. So today we pray for them. We sit in the cranium. And we know it. Come back to the center. Back to the center. Come back to the center. Back to the. I want that tidal wave. My last wave, right? I want to see rag up in the air. Flag up in the air. I want to see rag, flag, everything. So